All right. Well, good morning, everyone. Welcome to our Monday edition of our free webinars, Next Gen Nurses free webinar series. As you can see, I am not Elizabeth Diger. I apologize. She had a emergency in her family, and so I am coming to you this morning with our basic care and comfort lecture. Y'all, this is one of those ones that when I was in nursing school, I'm like, basic care and what? I mean, this seems really easy, right? But we all know that when you get down into the nitty-gritty, it can be actually very complex. So, I want to know, regardless, just let me know in that if you're joining me on Facebook or YouTube or you're here in Zoom, let me know, how do you feel about basic care and comfort? Is this one where you're like, I got it, no big deal, or you know what, I'm still struggling just a little bit. So let me know wherever you're joining us from, how do you feel about basic care and comfort? Feeling a little bit struggling, okay, no worries. Fundamentals of nursing, feeling okay, struggling. Yes. Okay. I definitely understand where you're coming from because remember, we are nurses too. We have been right there in your shoes waiting for the day when we get those results to say you've passed the NCLEX. And so remember, when we're bringing this information to you, we are people too. We are nurses too. So we understand those struggles. We get it. We've been there. So I want you to remember that as you're studying, as you're reaching out, if you have questions, if you have concerns, please don't hesitate. Send us out an email to nclextutors at archerreview.com. We're happy to help however we can. So, like I said, my name is Jennifer Bonner. I serve as the tutor team lead here at Archer Review, and I absolutely love what I do. You know, when you're a little girl and you're just excited about the future and you think about all the things that you want to accomplish in your life, you're like, one day I'm going to get a job. And then we grow up and we get a job and we find out that it's not so fun, right? I absolutely love what I do. I wish I could explain just how much I love it, but I absolutely do. I get to work with students. Typically, I'm working one on one with students. I could see those light bulb moments where, those tricky concepts come to life. I also do small group tutoring. I teach in the live review, which let me know if you're in Zoom. Raise your hand if you're joining us in the live review this week. I get to do some of that. I get to do a lot of the live webinars that we provide as well. And so it's just a fun opportunity. I get to interact with students one on one. When your emails come into us, they actually come to a person. So myself, Rachel Taylor, Elizabeth, we get these emails and we get to respond to you. So, a little bit of background about me: I have about 15 years of nursing experience. I started in a stroke ICU, moved around a little bit, did some endoscopy, ended up falling in love with labor and delivery postpartum, went and got my master's in family practice and realized I really enjoy the aspect of women's health. So I went back to school. Apparently, I love it, and became a certified nurse midwife. Finished my doctorate shortly thereafter and began practicing in a private clinic here in my town. I live in South Dakota. And then I transitioned into education about 3 years ago. So I've been with Archer for over 2 years now. And this is just a absolute delight getting to work with students just like you. So wherever you are, if you have joined us before, or the very next question from. So if you can jump into slido.com, you can enter in the code basic care and comfort, all one word, all lowercase, or you can take your smart device and you can scan that QR code right there on your screen, and that will jump you right into our Slido for today. And we'll be using this quite a bit. We're going to do some testing your knowledge as we go. All right, I'm seeing Alberta, Canada. Awesome. Seeing some Toronto. Minneapolis, Texas, California, Oklahoma, Nepal. Welcome. Oklahoma, Qatar. Awesome. Welcome. Welcome, welcome. Arkansas, Quinn. All right. So sorry. I am not sure what quite happened there, but looks like we are back. So we have most of you being able to jump back in. Okay. There we go. All right. So my apologies. Zoom just shut down for some reason, not quite sure why. And I noticed that there we go. Perfect. Okay. So, regardless of where you are at in the world, nursing is what brings us together. Now, we know that in order to become a nurse here in the States, we have to pass that NCLEX exam, right? And what the NCLEX exam does is it assesses our ability to provide that safe, that effective care in a lot of different nursing situations, right? Now, basic care and comfort is one of the categories that that exam is going to evaluate. Now, that is going to include parts of the nursing care that are fundamental for promoting well-being for and comfort of our clients, right? Key topics under basic care and comfort on the NCLEX type cares, assisting them with bathing, with grooming, oral care, perioperative care. That would be things like mobility, immobility, assisting our patients with getting up and ambulating, preventing complications that come with immobility, right? So we know that the longer we sit, the more of an issue we can have, right? Nutrition, oral hydration, monitoring and addressing those nutritional needs, administering enteral, parenteral nutrition, and even elimination. So helping our clients with getting up and toileting, continence, those types of things. Bowel elimination, interventions, rest and sleep, those types of things, assistive devices, and even alternative and complementary therapies. So, understanding and being able to integrate those alternative therapies when it might be appropriate. Now, remember, the NCLEX exam can present scenarios that might require you to apply some critical thinking and some of that nursing knowledge that you've been developing. And that helps provide that safe and effective care. So it's really important to have this solid baseline, this solid foundation of understanding of those principles of basic care and comfort. And that's going to help us succeed on this portion of the exam. Okay, why don't we go ahead and just some going back and forth with questions today. See, so the first thing we're in the chat, wherever you are, how do you feel about vital signs? Sometimes those can be tricky when it comes to pediatrics, and I'm going to give you a little bit of a hand up today. So when it comes to pediatrics, there are a couple things that we need to think about. One of them is I don't need you to memorize all the intricacies of the pediatric vital signs. I don't, if you want to memorize them, that is amazing. But a lot of times it's a lot, right? Because we know that there's one set for the newborn. And then when they get a little older, there's another set, and there's another set after that, and after that, and after that. But I want you to just kind of remember those general trends. So we know that the heart rate in a newborn, is it higher or lower than an adult? Let me know in the chat. Higher or lower? Yeah, it's higher in those infants than an adult. Very good. Now, what about the respiration rate? Is it higher or lower? Very good. You got it. Excellent. Oops. All right. Move this around just for a second. So I just want you to kind of understand those general trends because that's going to help you when you're looking at certain questions on NCLEX. All right, are you ready? So we're going to do some rapid fires, see where you're at on those basic care and comfort. Who's ready? Let me know. Raise your hand. Let me know in the chat. I'm ready. Uh, All right, here we go. I'm seeing a lot of ready. We're going to go back to Slido. All right, correct site for measuring a client's pulse rate. Where are we going to measure that pulse rate? Oh, someone's saying you're having trouble hearing me. Let me know if you're having trouble. Okay, I'm seeing radial. I'm seeing brachial. Let's go with adult. Seeing a lot of radial. All right, just a couple more seconds to get those answers in. Okay, just our everyday checking for a pulse. So remember, we're not looking for zebras here. If we hear hoof print or hoof sounds, we're thinking horse, right? So if you right now, somebody remind me in the chat, where do we check the radial artery? Where on the body are we going for that radial artery? You got a wrist. The wrist is where are we going to be feeling when we are checking for that pulse? Let's say it is, how long are we going to be feeling? I Apologize. I'm not sure what is going on quite this morning. 60 seconds, 1 minute. Yeah, we want to make sure that we are feeling for a full minute. Now, if our client is just fine, no worries. I too. Very good. All right, so let's move on to talking about the systolic blood pressure. So when go ahead and get this one going here. Number represent in our blood pressure reading. Pressure. We look up at the monitor. We have a top number Okay, I think we are back up and going. I am so sorry. I'm not sure what's going on with Zoom today. It's being a little a little bit different through it. So when we are looking at that systolic blood pressure, the thing that we are looking at is that pressure when the heart contracts down.